Hi and welcome to Mind 123. I'm Chantal and today I'm chatting to Dr Kate Owen. Kate, welcome back and thank you for joining me.
Thank you.
Now, can you help us understand how teenager sleep cycles are actually different to adult sleep cycles?
So what we know about the teenage brain is that it runs on a different sleep cycle to adults. And so the chemical melatonin gets released 2 hours later compared to an adult. So the teenager won't want to be going to bed until about 11 o'clock at night. Now, this will frustrate a lot of parents. You need to go to bed, you've got school tomorrow. So hopefully understanding this, then parents can just allay their own fears around their teenager not getting enough sleep. Now, what that means is that if the sleep chemical is kicking in later, then it's going to be lingering in their body longer in the morning. I am sure many parents can relate to, get out of bed, we need to go. But the fact is that that sleep chemical is still sitting in their body, 7 in the morning, 8 in the morning, etc. So the teenager does need to sleep. This is when their brain is doing so much rewiring and setting themselves up to become a young adult. So if the teenager is sleeping in on the weekends, I know it's really frustrating and can't always happen, and also understand at the same time is that they do need to be having that little bit of extra sleep.
I think a really important part of this is knowing what is normal for a teenager versus when we might need to worry a little bit about their sleep patterns or their behaviour. Can you help us understand that a little bit more?
Yes, absolutely. So the teenage years can be a little bit moody in itself. So the things to look out for is if the teenager is consistently withdrawing and retreating in their bedroom, is not looking after themselves in terms of their hygiene, you notice changes in their eating patterns, they're not socialising as much anymore, they're not finding enjoyment in the things that they used to do, they might be a few signs that, okay, maybe we should go and talk to someone just to make sure that everything's okay.
That's really great advice, and thank you very much for talking us through all of those changes in sleep cycles between teenagers and adults and what to look out for just to make sure that everything is okay at home. Kate, thank you for joining us today.
Thank you.